Hi everyone, this is LK. Welcome to my channel. Today we are going to learn about clavicle. So while explaining about the clavicle, we have to remember that a name reason. Because of key in shape, in Greek, the key we can call it as a clavicle. Because of the key in shape, we are calling this bone also as a clavicle. It is one of the long bone. And what are the important feature of the clavicle? In this video, we are going to discuss detailedly about the clavicle. So as I said, it is a key in shape. We can divide the entire clavicle into medial 2/3 and lateral 1/3. The medial 2/3 which is having the convexity in the front and the lateral 1/3 concavity in the front. And usually long bone will have one shaft and two ends, like will be upper end and lower end. But here in the clavicle, as it is ondally, and it is having two ends. One is in the medial, one is in the lateral, and medial end and the lateral end. The medial end is going to articulate with the sternum, otherwise known as sternal end. Lateral end is going to articulate with the acromion process of scapula, otherwise known as acromial end. And in this case, clavicle, as I said, it is a curved in nature. Now we are going to discuss about each and individually, lateral 1/3 and medial 2/3. Lateral 1/3, it is flattened in nature. Having two borders, one is anterior border, which is concave, and posterior border, which is convex. And the lateral end, it bears a facet. It is going to articulate with the acromion process of scapula. And the superior surface, which is smooth in nature, as well as it is subcutaneous. And the inferior surface, which bears a tubercle. So you can see here, there is a large, like a small bony prominence that is called conii tubercle. From that tubercle, there is a bony ridge extension called, that is called trapezoid ridge. Conii tubercle and trapezoid ridge. And now we are moving to the medial end. Medial end, it is quadrangular in shape. Quadrangular in shape, or otherwise rounded in shape. And it is having two areas. It is going to articulate with the sternum as well as the first rib, and it is not like a even. It is having the concavo-convex surface, and which is going to form this area, which is going to form and saddle kind of joint with the sternum. And now we are going to discuss about the shaft. In this shaft, like medial 2/3 of the shaft, it is having four surfaces: anterior surface, superior surface, posterior surface, and the inferior surface. Anterior surface, it is smooth, as well as some part it will be rough, which is giving an origin for pectoralis major muscle. The same way, the superior surface, medially, it is rough, which gives attachment for sternal head of sternocleidomastoid. The posterior surface, in the upper portion, it will give attachment for sternohyoid muscle. The inferior surface, it is having the oval shaped fossa, and this gives attachment for costoclavicular ligament. The same way, when you are going to the middle 1/3 of the clavicle, the superior surface, it is almost rounded. When you are going inferior groove in the inferior surface, the inferior surface, it is called subclavian groove. Why it is subclavian groove? Because it is giving attachment for subclavius muscle, and it is having two lips. One is posterior, one is anterior. Both lips are getting attachment from the clavipectoral fascia. Clavipectoral fascia, which is extending from below and splitting into two and enclosing the subclavius muscle and attaching on the both lips of the subclavian groove. And the posterior border, the posterior lip of the subclavian groove, the clavipectoral fascia, which is extending up to the conii tubercle, and it is continuing with the coracoclavicular ligament. Now, when it is called nutrient foramen of the clavicle, which is directed laterally, and it is getting nutrition by a suprascapular artery. And when you are going to the inferior surface of that lateral part of the shaft, and we can get a tubercle called conii tubercle, which gives attachment for conoid part of coracoclavicular ligament. The same way, the trapezoid ridge gives attachment for trapezoid part of coracoclavicular ligament. The same way, anterior border gives origin for a clavicular head of deltoid muscle. The same way, in that posterior border gives insertion for trapezius. Now moving to the ossification. The clavicle important feature is it is ossifying from the membranous as well as the cartilaginous ossification. The membranous ossification, usually the shaft will originating from the membranous ossification, and it has two primary ossification center. One is in the medial, one is in the lateral, and it is start its ossifying and 42nd to 50th post fertilization days, and the medial end, which is having the secondary ossification center. Occasionally, we'll get another secondary ossification center in the lateral end also. Clinical importance. Regarding clinical importance, the clavicle, where you are having the 2/3 and lateral 1/3, the junction of the clavicle, usually while you are falling with the outstretched hand, and this portion will get fracture, and this is the common site of fracture. When it is getting fracture, what will happen? This medial 2/3 is going upward because the sternal head of clavicle head of sternocleidomastoid will pull that medial 2/3 into above, and because of the weight of the shoulder, that lateral 1/3 is going below, and it will be like this way. Okay, medial 2/3 will be above, like anomaly of the clavicle, that is nothing but absence of clavicle, and usually it is associated with the anomaly of that skull as well as the cranium, and that is nothing but cleidocraniodysostosis. If you like the video, like, share and subscribe. Thank you.